Hi there. Thank you so much for joining me with my podcast, My Crunchy Life. Today I'm here with Dr. Khan, board-certified plastic surgeon, and he is also an advocate for breast implant illness. So, of course, he's here to talk to us today and give us some good information about en blanc and the difference in surgeries and the information that you need to have if you're considering an explant surgery. Hello, Dr. Khan.
Yes, good afternoon, Darby. Thank you very much for having me. It's a pleasure to join you. A very important and a real topic, and something that touches a lot of women, especially those who have implants and friends of those patients who have implants. And I'm here to shed some more light on my experience as a board-certified plastic surgeon from the American Society of Plastic Surgery to share with you my experience in regards to what is breast implant illness, and at least what my experience has been from the many patients that I have seen and the intraoperative experience as far as management before, during, and after.
Awesome. This is awesome. Okay, so where are you located exactly?
So I'm in Novi, Michigan, which is one of the suburbs of Detroit. It is just east of Ann Arbor, Michigan. For those who are Michigan fans, I am approximately 25 minutes or so away northeast of the University of Michigan college campus, and so in the suburbs of Detroit.
Perfect. Okay, great. So do you have a lot of people that come and see you from out of state?
So breast implant illness is a disease / sign, symptoms, and a syndrome where patients who have educated themselves from just social media and also the other doctors' experiences have come to realize and starting to realize what exactly it means to be a explant surgeon. And basically what that means is one who specializes in removing the implants that have been placed by other doctors. So it is very important as one dwells into this world of explant surgery and as one educates themselves, it is very intense and something that is not well defined. And you have many board-certified surgeons who basically remove implants, but from my experience and the experiences of patients, they realize themselves that not every plastic surgeon is an explant surgeon. And so for that reason, the patients seek us out and they travel. So just this week, I've had calls from Colorado, from California, and patients who are willing to travel so that they know that they're going to get operated on by an ASPS board-certified plastic surgeon. And also, more importantly, that they're going to get the surgery that they very much deserve, which is ideally and the gold standard, the en bloc removal of the implant, which basically means that the implant and the capsule that forms, which is the foreign body reaction by the body itself, is removed en bloc, that is, as one unit, one piece, one entity, such that the implant that which is within the capsule has not seen air, so that if there is spillage, rupture, or fungal infection, name it, or an abscess, it doesn't spill into the chest cavity, which is the best way to removing the implant and the capsule all as one piece.
Right,
so
and that makes sense.
Right, and so to answer your question and to expand on this a little bit more, so the patients are smart. They now, as they have heard their friends say, well, I went to another surgeon in town, I did not want to leave town, they realized that the surgeon, the way they were doing it was they were leaving part of the capsule behind because it was adherent very tightly to the chest wall, and it was a difficult, basically, a resection, and hence they chose to leave 20% of the capsule behind. And as you will see, that 20% of the capsule will have residual silica / potential rupture, and it will continue to propagate and induce the immune system of the body to continue to mount a response, and hence the breast implant illness sign symptoms that will continue to linger on despite the implant being removed and despite 90% of the capsule being removed.
Well, so that's actually interesting. As you know, I have a breast implant illness group called Breast Implant Illness Detox and Healing, and we see a lot of women. I mean, probably 50 new women a day often that just find us because, like you said, it's affecting many women. But I have, every now and then I'll get women who tell me that they aren't recovering as fast as the others. And I often wonder, they believe that it was removed, but they're all having it removed in different ways. Insurance isn't always covering the en bloc. It's not, sometimes it covers the other way. There are some insurances, but because of that, because there are women who are feeling just as terrible, it makes me wonder if the doctor didn't remove everything, if that silica, like you say, which is, leakage from the implant that is in the tissue, if that's still affecting them poorly, if something ruptured into their bloodstream, they don't always know what happened when the doctor removed it unless it was videoed.
Sure. So it is very important for the patient to comprehend, and now this is a very difficult topic to grasp. Even if I talk to my internal medicine or family medicine doc, they are still not familiar with these terms. So one thing I would suggest is if I would direct for any of the patients, be it in the United States or outside in Europe or South America, to go to my website, and which is the Khan, Khan, Plastic Surgery Academy, and to basically go in and look at some of these explant videos where I show that the implant and the capsule is being removed en bloc as one system, and then on the table, once I'm done with the surgery, because I don't want to open this up during the case, I open up the capsule for the first time, and you will see as I open up the capsule and I look at the internal aspect, I find that there are sand-type granules, which are the silica. And this is very similar to sandpaper that if you were to pass your fingers on, you would see, and the way I describe it is if you take sugar and you pour it on some tissue paper, and then you pass your hand directly over that wet tissue paper, this is exactly the type of capsule that I have removed in the women. And if you can, and certainly what I do is whenever I remove the implant and block, I always 100% of the time send the capsule to pathology, because I want them to look at the capsule and, number one, to definitively confirm that there is no malignancy. Because remember, 1 out of 8 or 9 women are going to get breast cancer. We don't want this abnormal tissue to be overlooked in thinking that this is just scar tissue. Number two, if there is any abnormal tissue or fluid that needs to be sent to cytology, because that cytology fluid could very well indeed be lymphoma, which we all know of, which is the ALCL, which is the anaplastic large cell lymphoma, which is the reason why France stepped up a couple of months ago and banned the textured implants, because it was linked to the breast implant associated, which is the BIA-ALCL. And then third, last, at least if the implant, I always return to the patient, be it saline or silicone, because the patients usually ask for it. And this is something that I find it is normal. Instead of removing it as biologic waste, I give it to the patients in a bucket so that they know what and exactly. And I always, the last thing that I almost always do, I send cultures for aerobic, anaerobic, and fungal, just to make sure we're not missing on something that might potentially be missed. Now,
that's
one
smart,
thing,
because I know that a lot of these women are coming back finding later having to do separate testing. Now, really quick before we move on, I wanted to ask you something about that silica. Is that something that can move into the bloodstream or get stored into the fat?
Absolutely, absolutely. So what I want you and all the listeners to do is just go to Google and type in silica, S-I-L-I-C-A. This is, again, on my website. This is the pathology report that came back from the capsules. And this is where they refract light and they analyze and look under the microscope, just like the pathologists do for a living. And they basically confirm this being silica. And if you go Google silica on the computer, you're going to see that these are the crystals. Like when you buy a nice coat, you will find this is that small packet Now,
Right.
it will say silica, do not eat, do not consume,
Yeah, do not
throw away.
eat. That's what I was
Yes.
going to say. It
And
says
so,
do not eat.
and obviously we're not saying that this is the same silica, that this is within the silicone, but this is the same. If you look at the polymer, if you look at the content, this is what they write on that packet. Now, I have not analyzed it and compared it to the breast implant, what it is structured or made up of, but I will tell you this is the same chemical and the same material that basically the body mounts its immune response to. And this is why I say to all my patients who are interested in getting implants, and my colleagues, plastic surgery colleagues, that why would you not want to remove the capsule that has the silica embedded within it, which is part of silica, because this is what the pathologist is telling me. So, and this is what I tell to all my colleagues, you have to go and you have to remove the implant and the capsule and block. Now, majority of the times that's very possible because you go in through the inframammary or below the breast tissue incision, which is usually 10 to 12 centimeters, depending on the volume of the implant, and you remove it with ease because that's the best access. You don't want to go around the depths of the nipple, for they are not truly sterile, and I do not want big incisions around the nipple area or the areola area, and these are incisions at the inferior aspect of the breast that's where you can easily hide and camouflage into the contour of the lower part of the breast.
What if they get a lift?
So one thing I always tell, depending on the age of the patients, the lift is something that I don't necessarily choose to do on the first visit, because when you do the end block, this is an extensive dissection, and the skin basically is also reactive. There is swelling, there's inflammation around the breast implant and also the capsule that has formed. And so what I tell all my patients, and you will see, they document themselves, the doc was right. I did not need a lift, because what happens is once the inflammation recedes and goes away over the next 3 to 6 months, and especially the implant volume effect goes away, the skin has the elasticity and it basically retracts and basically normalizes and equilibrates. And we know from our experiences, whenever we do an explant, it takes up to a year for that skin to settle. And so many of the women who initially would think they need a lift at the time of the explant do not end up requiring one. And so for that reason, I say wait. Now, every patient is different, and normally I cannot say, well, I never have done a lift, so that is absolutely not correct. But I always say get the implant removed first, and then come back another day, a year later or two, in another controlled setting, and do the lift definitively, which will last you a long time. There are many reasons why I don't want to do a lift. Normally, the explant surgery and block takes 3 hours to 4 because of the meticulous dissection from the time we go in and the time we come out. You don't want to do a lift which prolongs the case into the 5, 6, 7 hours, and that in itself can be a potential source for infection. Number 2, you don't want to do a lift and the skin retracts more than what you would like, and the next thing you know, the nipple areola slash where it ends up is elevated or higher than what you would like, and that is a very difficult problem to fix. Number 3, you do not want to insult those flaps by doing the lift, and the next thing you know, the skin, the nerves, and the flaps themselves, because of the dissection that you're going to do in order to do a true lift, you may compromise the blood supply. Now, having said that, I have done lifts, and I have done, because that's another window of opportunity depending on what I find when I go in. For example, if it's an 82-year-old lady that I operated on, I don't want her to come back in a year or two and get a lift at that time. I can certainly do it, and do it in a very, very defined way, so that the patient, this is the last patient that the last operation that the patient needs. Now, one thing I always want to mention, Darby, sometimes you remove the explant and then 3 weeks later you find that the patient ends up getting an infection because there was an indolent infection which was not noticeable, and you did not see frank pus or an abscess or an infection. Now, it is extremely, extremely important for the patients to seek out surgeons who have a full functioning operative room which means that's the main hospital, or they have at least a quad SF, which means that it is a certified, authentic surgery center, which is certified by the American Association of Ambulatory Surgical Centers, so that the patient gets operated on in a setting that is being certified, which is the gold standard, because you don't want to be being operated on in a small procedure room which doesn't have the right ventilation, the right equipment, the right sterilization. And the next thing you know, the patient had no abscess, but the instruments that were not autoclaved, or there was no sterility techniques, and now you have introduced an infection that the patient did not have at the time of the explant because it was not a clean operating room.
Yikes.
Very important. So I will tell you this, and I'm going to present this as well. I had a patient came in last week. She was going to get explants, I'm not making this up, for $700. And the patient herself is going to come up on one of the Facebook sessions that I'm going to have set up, where she was going to be operated on in a small procedure room at a doctor's office, which is where, believe it or not, most of these doctors end up doing the surgery. And the other thing I must mention, which is extremely important, is that your surgeon must be ASPS, 2 requirements. And this is a no-brainer, an absolute no-brainer. Number one, the doc must be ASPS, board certified, which means the American Society of Plastic Surgery. This is the only one reputable administrative society in the United States of America that authenticates, verifies, and certifies plastic surgeons to be the real deal. Everyone else is all what I call elastic surgeons or wannabe plastic surgeons, because I could form a group right now and say American Association of Cosmetic Surgeons of North America. You have never heard of this. I'm the founding father. And guess what, Darby? You can be a member if you pay me a fee. And I don't have, and my clause is that you don't have to be an MD, and you could be a breast implant illness advocate. And this is my criteria. And so now all of a sudden you have nice, innocent patients, and I use the word because they don't know any better. And so there are ENT surgeons that are not board certified who are placing implants. There are dermatologists who are placing implants. There are emergency room doctors right here in town, and I'm not making this up, and we all know this is a fact, who are placing implants. There are general surgeons who are placing implants, and I will tell you this is concrete, real information. So there is this ASPS logo, which is, again, no one of these surgeons can put that, otherwise they will get sued. And there are not that many of us who are the ASPS board certified plastic surgeons, and we go through this standard of training, usually 7 to 10 years, depending on where and how we train, so that we have the right skill set in order to do the respective surgeries.
Well, that's good to know.
Yes, and so
the listeners need to take note of that, because I see, like I said, I see a lot of women telling me, I see a lot. I see a lot in my group, and you know, I'm heartbroken for them because, you know, like you said, we don't know any different, and we go in there, and if you have a doctor who's a good salesman, then you think that you're in good hands. Right.
And so there's 2 important things. Number one, you have to make sure that they're an ASPS, and if you type in ASPS plastic surgeon, American Society of Plastic Surgery, again, Google this, you will see what I call the O sign, which basically is the certification that this doc is real and trained in plastic surgery by the medical center that specializes in training plastic surgeons, period. And number 2, you want to also make sure that the patient is seeing a ASPS surgeon who specializes in explants, because, you know, one of my very close friends, you know, he's probably put in 10,000 implants over his career, and he does exclusively breast. One of my other patients who went to him in town, he was not going to remove the capsule. And again, this is something where many of the ASPS plastic surgeons truly do not believe in the breast implant illness. If I call 9 out of my 10 friends up, they're going to say, what is breast implant illness? I have not read on it. I did not train in it. And so this is something that you have to acknowledge, and you have to firmly believe in wholeheartedly. Otherwise, you're not going to offer the patient the end block, because why should I do something when I don't believe in it?
Yeah, I agree. Well, is all great information. A lot of this who are looking into explanting, and I know that it's called the TITS Committee. They are a nonprofit, and we work with them. As you know, I have a nonprofit called the Lemonade Group, and you were just added to their list as an approved doctor. So, I'm glad that we're having this interview so I can share it around to. I'm going to be putting this on our group. And I'm just happy that we're getting to have this chat. I'm learning so much. I did have I've had my implants removed myself, and there's I researched like crazy because that's what I do, and it's wonderful to know all of this information. I'm learning stuff too, so I think it's awesome to talk to you and to speak to a doctor who's so passionate about it. It's really a breath of fresh air.
No, I appreciate it, and I'll tell you this. I see it in the patients when they come to me before, and I see the drastic responses before and after. And, one thing that I will say is you have to go to the third criteria that I will mention, if I may, is ideally go to one who only removes the implants, because that's your best bet. Because, we know the docs in the United States who are exclusively removing implants for that reason. And, hopefully, this is the message, this is the request, this is, lack of a better word, my utmost desire that we talk about it. Number two, I want the women and the men, and I want the potential patients who are interested in getting implants to go and see what exactly it means. Getting an implant doesn't mean that you get the one surgery and these are good for you for the rest of your life. No, they come in, on average, they're a 10-year lifespan, some less, some more. And an average woman who is in her 20s, who's going to live to an 82, 85, whatever the average lifespan of the American average woman is, they're theoretically will have it changed 4, 5, 6 times, let alone the questionable biopsies that may need to be done in order to rule out malignancy. For example, like I had a patient come in last week. She was seen by her primary care doctor who was concerned about 3 masses that she had.
Wow.
She had fibrocystic disease, but there was certainly concern given the family history that she may have a malignancy. Now they want to go ahead and get a ultrasound / needle localization like a biopsy, but they're afraid that this mass is right next to the implant, and she's not able to get a true representative biopsy of this mass. And this could very well indeed be breast cancer. And so now there is this challenge of keeping the implant, removing the implant, what to do with the capsule. Is this fatty necrosis? Because this was done by a non-board certified plastic surgeon who placed it above the muscle and not below. So there are a lot of things that need to come into play. And one last thing that I will say, and which is extremely important, in my practice, I have a list of questions, a questionnaire, and I ask the women, please check over here, what are your signs and symptoms, so that I can learn, because this breast implant illness is not a true diagnosis yet. And this is a vague series and sets of problems, be it headache, brain fog, joint pain, eye dryness, GI issues, irritable bowel syndrome, rheumatological problems, and literally touching every aspect from suicidal thoughts to anxiety, depression, name it. Lethargy, not being able to exercise, getting out of bed is a challenge, amongst them. So I basically, and I tell the patients, I cannot promise anything. What I can say is after the surgery, we will know definitively what the extent of the relief is and how you rebounded back into your life. And you see the testimonials that the patients themselves, and this is a social media phenomenon where the patients themselves say, wow, I feel like $1 million. And the only thing between now and last week was my implant coming out. Is this a coincidence? Were you magically gifted by God that you now had, the demon that was, essentially outcast from your body? I mean, the bottom line is you put the 2 and 2 together and you have literally thousands and thousands of women who basically have come forward and said, wow, look at my picture before, look at my selfie after the implant. I had a lady that came in last week, and lo and behold, Darby, she's like, I need an upper blepharoplasty and I need a lower blepharoplasty. She is, an upper eyelid lift and a lower eyelid lift. And I look at her and I said, you have implants? And she's like, how did you know? And I said, I do not know, but you look at your face and look at all these women. And I went to Google Images and I said, breast implant illness before and after face images. And you see all these women, they literally take a picture before the explant, and then
I know,
1 week after, 1 week after, 1 month after, and you see this is now, I say to the patients and to the docs, these are not women who are trying to market themselves. They're taking innocent selfies. They're not promoting anything for the fact that look at all these pimples, all these acne, all these scars, but look at all this tired-looking face went away on its own. And they're not promoting anything. They have nothing to gain except for the fact that they're going to, and they're brave enough to post this on social media so that the world can say, someone from, like I say, California, someone from Phoenix, Arizona, say, you know what, I think I have the same problem. And I told her, you don't need a bilateral upper eyelid or a lower eyelid lift, or what they call a blepharoplasty. You need to get these implants out, and I promise you, if anything, and I said, I cannot guarantee anything, but I'll tell you, I'm not going to offer you the surgery. And you know what also I told her? Don't go to another surgeon who at age 40 will offer you the upper eyelid lift and the lower eyelid lift just because you asked for it, and we have to go to the root cause of the problem. One last thing I'm going to say is, one of the second questions that I always ask is after the questionnaire, which I've set up and said, just so that I can capture all the different problems that the patients come in with, the signs and symptoms. The other thing that I ask all the patients is, who did the surgery? And you will be surprised, Darby. I have had patients that have had silicone implant on the right breast and saline on the left. I have had patients where one silicone was placed above the muscle on the right and below the muscle on the left. I've had implants that were different sizes. And again, this is all being done by non-ASPS board-certified surgeons who do not know what they're doing, and they essentially have done on-the-job training. So as you see, the ENT surgeons, how much of a breast experience have they had? These are ear, nose, throat. They might have done an elective 1 month, or they might have done a weekend course, and now they're marketing themselves to be breast surgeons. And, I have a breast surgeon in town who is an ENT surgeon who is not certified, and he does exclusively breast, which is a big shame. And this is not the standard of care by all means. So the point is, going to the reputable source, a reputable surgeon who has the right training is the most important thing. You don't want to get, he was $3,000 cheaper, so I went there. No, this is a compromised care that you got from this doc, and we need to put an end to this. And we as a Plastic Surgery Society has spoken, and we have said a lot, and I continue to do my part as far as educating the patients. Just because I wear a white coat, I'm not the expert in pediatrics. By all means, I'm not. I have no concept of pediatrics, and I say this very openly and wholeheartedly. I'm not trained in kids, and I do not know how to treat a kid because that's not my area of training. And so I pass it on to my colleague in pediatrics who can manage that. Neither am I a cardiologist because I don't do basically cardiac casts, for example. I'm not going to take the challenge. But when it comes to plastic surgery, when it comes to the training, that's very important. So as a board-certified general surgeon and as a board-certified plastic surgeon and also trained in burns 10 years after medical school, I have done a lot of reconstruction, so I know when it comes to what it means to remove the breast implant and also to remove the capsule and the post-op expected recovery, and more importantly, the complications that one may run into during the surgery, and to be able to manage those post-operatively.
Wow. So much great information, Dr. Khan. Thank you so much for all of that. I cannot wait to share this with everyone. And if you're listening and you think this sounds like something that a friend of yours, a family member needs to hear, please share it. And make sure to check out Dr. Khan's website and his YouTube channel. His YouTube channel is Khan Plastic Surgery Academy, and that's KHAN. Thanks so much.
Thanks, Darby. Take care. All the very best. Thank you.
You too. Bye-bye.